Hi everyone, I'm Dr. Dheeraj Tiwari, Head of the Department of Interventional Radiology in Narayana Health City, Bangalore. Today I will be discussing about a very common problem in the women in the reproductive age group, and that is uterine fibroids. Uterine fibroids are the benign growths in the uterus. There are three types of fibroids. One is the subserosal fibroid which project outside the uterus, and the other is the submucosal fibroid which projects inside the uterine cavity, and the third is the intramural fibroids. The fibroids can be treated by a latest advanced technique which is known as uterine artery embolization, which is performed by interventional radiologists. If you are having difficult periods, including the symptoms of heavy bleeding for prolonged duration, or severe cramps in the abdomen, or a repeated urge to pass urine frequently, or any back pain or pain radiating into the legs, you may be suffering from uterine fibroids. The uterine fibroids can be diagnosed on ultrasonography, and most of the fibroids are suitable for uterine artery embolization. Uterine artery embolization can be performed in local anesthesia and with mild sedation. It is not a surgery, it is a pinhole technique in which we puncture, usually in the wrist area or in the groin region, to send a catheter which is very small in size, almost 1 to 1.5 millimeter in size. A catheter is advanced into the blood flow of the uterine fibroids. Once the catheter reaches up to the desired destinations, we inject particles, small PVA particles. The PVA particles occlude the blood flow, thereby the fibroid shrinks. Once the embolization is complete, we look for other collaterals supplying the same fibroid, and they can also be tackled in a similar way. Once the embolization is over, we remove the catheter. We can compress the local area from where we had inserted the catheter for about 5 to 10 minutes. Uterine artery embolization is a very safe and effective method which has been proved by various studies. So if you have similar symptoms, you can approach your interventional radiologist and get assessed that whether the treatment is possible by this method.